Hi, everyone, and welcome. Thank you for attending COVID-19 Science in the Media Lessons Learned Reporting on the Pandemic. My name is Chloe Reichel, and I manage communications for the Petrie-Flom Center. The Petrie-Flom Center for Health Law Policy, Biotechnology, and Bioethics at Harvard Law School is delighted to bring you this event. Before we get to the discussion, a few housekeeping items. We welcome audience questions for our speakers, so please submit your questions. You may be asking, how do I submit questions? The best way to do that is to use the Zoom Q&A feature, which if you scroll to the bottom of your Zoom window, you'll see a little button marked Q&A. Just type your question in there and I'll be checking it frequently, and our moderator will be choosing from those questions. You're also welcome to join the conversation or submit questions on Twitter using the hashtag COVID reporting. Again, that's hashtag COVID reporting. If you do submit a question there, we'll be monitoring it and we'll pull your questions into Zoom Q&A feature. Ways that you should not try to submit questions, the raise your hand feature on Zoom, we will not be checking that feature. We've also turned off the chat function, so please do not submit questions there. If you're interested in this event and other health policy, bioethics, and biotechnology topics, we strongly encourage you to sign up for the Petrie-Flom Center newsletter. You can scan the QR code on our welcome page. You can also read our blog, Bill of Health, which features cutting-edge commentary by legal scholars, public health professionals, and more. With that, I will turn things over to our moderator, Alexandra Phelan, who will launch into the event. Thank you.
Thank you very much, Chloe. My name is Alexandra Phelan, and I'm an assistant professor at the Center for Global Health Science and Security at Georgetown University Medical Center and adjunct professor of law at Georgetown University Law Center. I have the great privilege of moderating today's event, which seeks to bring together 4 exceptional journalists who have contributed to and shaped the information landscape of this pandemic. As the pandemic has demonstrated, the governance of international, national, state, and local responses to infectious diseases is much more significant than historical pandemic preparedness evaluations have given weight to. At the global and domestic levels, science, public health, and technology may not necessarily have the capacity to completely stop spillover events, but policy, executive action, and legislation may have the potential to stop an outbreak from becoming a pandemic, strengthening health systems and addressing inequalities. We've seen how it's not simply vaccines that prevent disease, but the process of vaccination. And it's at these intersections of governance where impact is most tangible, enabled by political advocacy, the media, or even legal challenges. However, as the US experience in particular has shown, not always in the direction that protects public health and the most vulnerable. And so it's also at these points of intersection where journalism can be especially valuable as part of pandemic response and as part of achieving justice. I want to now open the floor to each of our panelists in turn to share with us their experience and reflections of their work over the last 22 months or so. And so if I may first turn the stage to Amy Maxmen. Amy, it would be lovely to hear some of your reflections.
Well, thank you so much. It's a real pleasure to be here. So I'm Amy Maxmen. I'm a senior reporter at Nature, and I've covered a lot of outbreaks. I would say kind of my go-to, preferable move in an outbreak is to actually see what's happening in communities during outbreaks. The response to outbreaks, no matter the pathogen, has a lot of commonalities, and but what really happens on the ground is often quite different. So I've reported on Ebola in Sierra Leone and in DRC, on Lassa in Nigeria, on malaria in Cambodia, and of course I'm here now during COVID, here being the US. And so yeah, I like, similar to what you were just saying, I like to see why is the response not working for specific reasons in a way that sort of illuminates what's going wrong with systems. So for example, just before March 1st of 2020, I flew to Seattle because that was where the first domestic US outbreak was happening. It was at a nursing home in Seattle, or just outside of Seattle. At the same time, a teenager had just been diagnosed with COVID. And he had not gone to China. He had nothing to do with the nursing home. So it meant that COVID was spreading below the radar. And that means that surveillance is failing. So I met with researchers who had tested this teenager, but also who suddenly told me that they had developed tests since late January and February, and they had been pushing the CDC and the FDA to be able to use them, but they were not allowed to use them. And it was with their immense frustration and also just their worry about how much COVID is probably spreading that really woke me up and made me realize that the outbreak was going to be very bad in the US. I would say the reason why I was naive about that was because of my reporting abroad. The CDC is really looked at as sort of a model public health institute. CDC researchers fly around the world when there's outbreaks. We have so many infectious disease experts, people who study pandemics and epidemics. There's no issue with lab capacity. The labs I went to in Seattle are incredible. They're definitely not, relying on some backup generators when the electricity goes down every day. So at this point, seeing that they had been unable to test, at that point, I really became obsessed with sort of figuring out what was going wrong in the US, but also like, what was it illuminating? Because if we're gonna, curb this pandemic and fix the next one, we need more than just sort of a Band-Aid for when things break. Just to name like some examples, I reported last year when there was a big outbreak near me at the San Quentin Prison. I learned that, and I should say not just a big outbreak, it was one of the top 3 outbreaks, I think, last year. Before that outbreak happened, for months, researchers had been telling them, they really need to test inmates and staff at the prison. They had even sent them boxes full of vials to collect sputum for samples for testing. That was rejected. So were all of their recommendations about ventilation and about depopulating the overcrowded prison. The system was just really inflexible. And so that's why it couldn't take any of that advice. For another story, I made a few visits to a part of California that was hit really hard. It's one of the biggest agricultural regions in the US, the San Joaquin Valley in California. And there's huge farms, there's lots of poverty, and that's usually among the people who work on the farms and in food and in meat processing plants. And I talked with all the agricultural workers there and also community workers who work with them about why they couldn't get tested, why isolation is impossible, kind of why there was why sort of the leaders of that area were not moved enough to sort of make a difference in those communities. And I think sort of the sad idea that emerged was sort of the exploitation of people inherent in our economy was really what was fueling the pandemic. That piece got pretty political because that was the underlying reason there. Another commonality in my reporting last year was that when I wanted to see where is COVID spreading and why, data was often lacking. And there were a few reasons for that. One, probably the main one, is that we lack a national system for data sharing. It's very outdated. So, data is often really siloed, even when it's the same person we're talking about, from the data that there's collected at a hospital versus the data that's collected at a lab versus the data that's collected in health departments. Another reason is there's not a lot of incentives or need for places to share information. Like prisons don't necessarily need to report outbreaks to the CDC. More recently, just to fast forward into 2021, and just recently, I've really been concentrating on this shameful situation you mentioned, in which we have vaccines and yet rich countries are hoarding them. And there's no real mechanism to distribute vaccines equally around the world, or even close to equally. And there's no mechanism to force companies to share technology. So in another piece, I wrote about why we're not prepared for another pandemic, and that kind of lack of a mechanism to share technologies like vaccines is one reason. Another one is there's no solution to the misinformation mess we're handling right now, or not handling well. So I'll sort of stop there, but I guess just as an overall, I'm really focusing on the systemic failings that lead to this outbreak.
Thank you so much, Amy. And I think that sets really nicely the scene for us to go across the Atlantic to Kai Kupferschmidt. If I can hand the floor over to you, Kai.
Yes, sure. Thanks, Alex. So I'm Kai. I work as a contributing correspondent at Science magazine. So I'm based in Berlin, but obviously I write for a US publication. And yeah, and I think it's kind of important maybe to understand that, of course, we're in a very special situation. I think it's probably a little bit similar for Amy at Nature, because compared to a lot of other newsrooms, we have, you know, an amazing depth of science journalists, but we don't have the, you know, political journalists or the economical journalists necessarily that others have. And I think that's very interesting in a pandemic, because, you know, even though the word pandemic comes from affecting all people, of course, it also affects all walks of life in a way. And it kind of showed me again something that I've been learning. So I've only been a reporter for 12 years, basically. And I went into this, I studied molecular biomedicine. I went into this being maybe a little bit too fascinated by molecules and not fascinated enough by humans. But it was just like, for me, when something happened, when an outbreak happened, like what I was fascinated by, the lens through which I looked at it was this question of, okay, you know, has the virus changed? Is there interesting evolution going on? You know, are there mutations? And that really changed for me during the Ebola outbreak in West Africa. I really realized there that when that happened, and it was this huge outbreak that we hadn't seen before, and I was asking all of the usual suspects, you know, so what's different with the virus? And nothing was different with the virus, or very little as far as we know now. It was really about the population that it was affecting. It was about, you know, the historical situation in these places. It was about the health system in those places, and the abject poverty there, and the mistrust in the government after, you know, 2 civil wars. So all of these things. And, you know, I talked to Christian Drosten about this not so long ago, and he was telling me, you know, I didn't see that either. I was traveling across these roads in West Africa, these new roads along which this virus was spreading, and I didn't see it. And I think that really changed for me how I looked at these outbreaks. And then comes this pandemic, and I realized that there's, you know, that it's going to play out very differently in a lot of different places. And one of the advantages I think that I had working at Science compared to, say, if I was working at a local newspaper in Germany, was that I could afford to, you know, look at it in a global way as much as I can. I mean, there's no way of keeping up with this everywhere, but you could focus on, you know, certain countries, try to understand what is going on in certain places, try to understand just, you know, the overall movement of the pandemic in a way. So in the beginning, I really tried to do that. That became impossible fairly soon. And then it became, at least for me, it became this very difficult situation of having to jump back and forth between different topics. Like I would look at the Solidarity trial or the Recovery trial, really important trials on experimental therapies. And you'd do a big story, and then you'd move back to vaccine development, for instance, or, you know, or a report on the origins or whatever it is. And then, you know, you do that and then you move back. So I think one of the difficulties for me in reporting all of this was that it was very hard to stick to kind of one aspect of it. And I think the other thing that I really realized in the pandemic again was we love telling stories about human beings, and it's, you know, they make it interesting. And we've all written, I wrote a profile of Christian Drosten, for instance, I mean, who's really shaped in some ways how Germans see this pandemic and how we've responded. When the pandemic started, I was sitting in Tedros's office, the Director General of the WHO. I was there in December 2019 to have a talk with him about whether the world was ready for a pandemic. And, you know, he told me a lot of the things. We were talking about measles and the fact that you had vaccine hesitancy in rich countries, and then you had, you know, access issues in poorer countries. Like all of these issues that would play a role in the pandemic, you know, came up in that conversation. And it made me realize again that while we love writing about people, it is really the structures, as Amy highlighted as well. And it's very, very hard for journalists, I think, to write interesting, exciting stories about structures. But I think if we are going to, you know, do better in the next pandemic, the question is, are we going to have the structures? I mean, Amy talked about the, you know, the vaccine inequity, which is, you know, really just one of the worst things in this pandemic. And if you look at it, COVAX was trying in some ways to do it, but it was probably set up too late to really do it. So the question is, the next time we have a pandemic, are we going to have something like COVAX already set up? Are the lessons that we're going to learn from this pandemic are they just going to be lessons in some people's heads? And when these people, don't have a job anymore, or are dead one day, these lessons are gone. I really believe that the only way that human society learns is by taking these lessons and forming them into structures that then kind of, live longer than any individual that has learned anything. So that's what I'm struggling with at the moment, is trying to write stories that do that. I find it much easier to write about the science. I think the stories that I'm proudest of about the evolution of the virus, or about the super spreading, the dispersion factor, these things, that goes back to what I trained. And I think what I find interesting for the next years is really to try and tackle this other, for me, much harder issue. And I think we need to tackle it as a society, of course.
Thank you very much, Kai. I think that really goes to the heart of some of the point of today's seminar, is to also look at how COVID-19 has changed what it means to do journalism, and the focus of journalism as well. And so if we come back over to the US, I'd like to turn the floor to Apoorva Mandavilli. Apoorva.
Thanks very much for having me. It's a real honor to be with these amazing journalists whose work I've been reading. My name is Apoorva Mandavilli. I'm one of the COVID reporters for the New York Times, and I joined the Times during the pandemic to write about the pandemic. So I actually had been the editor-in-chief of a small science magazine before this. I was freelancing for the Times, mostly about HIV and TB. But when the pandemic hit, it was really hard to pass up a chance to do this full time. That the Times offered me a job, and I could not think of how I couldn't be at the front lines of such a big story and such an important story. Kai and Amy both talked about working at these science journals where the depth of expertise is very deep, but maybe they don't have quite as much manpower. And at the Times, it's probably the opposite in some ways. It's a very big paper, huge newsroom, lots of expertise in politics, in international relations, in every kind of topic that matters to this pandemic. But the science desk itself is not huge, and not that many people on the science desk write about really hardcore biology. So I had the luxury of being able to choose what I could focus on and what I could leave to other colleagues. So they were, people doing other aspects of the pandemic, and I could write just about the sort of hardcore science of the virus, or what we were looking at in terms of the contagiousness, or about immunity and things like that. So with the big platform, though, also comes the challenge, which is that if you write for the Times and you are a woman of color and you're writing things that people don't really want to hear, there's also just enormous backlash pretty much all of the time. So I've had to also learn to write without taking that into account, or without letting that affect me. And one of the ways in which I think actually that has been helpful is because even though it can be hard to take at times, it's also very informative in showcasing where the misinformation is. I can tell from what people are getting really angry about and what people are saying a lot of nonsense about, that's where information is most needed. That's where the most myths are. And it has actually given me a lot of story ideas. So I think in that way, it's been helpful to be in the middle of all of that craziness. And I think overall, for all of us, this pandemic has been an exercise in not just doing journalism, but truth-telling and correcting untruths on a pretty regular basis in a way that we don't necessarily have to do all the time when we're writing about other things. I mean, obviously there's been misinformation with other things throughout, climate change and evolution and things like that, but this is an unprecedented level of misinformation and disinformation campaigns. And last year, we were facing that even from the White House. So that was really unusual to have to correct the government on such a regular basis. I think that's one other way in which my job has been different during this pandemic is also that institutions that I would normally hold in more regard or maybe trust more, like the WHO and the CDC, I have been more skeptical of. And I think there have been times when the stories have actually been about how the WHO and the CDC are not being helpful enough to the world. One of the stories that I'm most proud of is a story that I wrote about the WHO not really acknowledging that indoor transmission of the virus is a really serious problem. And an amazing journalist called Roxanne Kamsi first wrote about this in Wired, and I really expected that to shake things up, but nothing changed. Nobody talked about it more. Nobody changed anything. And so the story became, why is the WHO so reluctant to acknowledge this? And the answer turned out to be something so pedestrian in a way. It was because people didn't agree on what the term meant. What the term airborne should mean for hospitals versus regular people. And there was a lot of argument about what that would mean for hospitals in terms of updating their ventilation systems. And so while they're figuring that out, people didn't really understand that indoor transmission of the virus is dangerous and it's a big deal. So that story, within days of it coming out, the WHO changed its guidance and said that airborne transmission is a real risk indoors. And so that's not the kind of story that I would normally have done, just taking a big shot at an agency like the WHO. And similar things with the CDC. Last year, some of the stories I wrote were actually about how the Trump administration was doctoring documents that were coming out of the CDC. Again, the CDC is not an institution that I would normally, I mean, of course, you're always skeptical as a journalist of any government institution, but not to this degree where you're thinking that everything they're writing is a lie or is in some way misleading the public intentionally. So that is a layer of reporting that I think got added to this pandemic that made it challenging for all of us science journalists. But the bulk of my time I spent really writing about science. And one of the things that I think has been really cool about this pandemic is how interested people are in learning about biology. I mean, I would not have dreamed that I would be writing in the New York Times about cycle threshold values of PCR. That just is not something that you would think the average person would care about. And yet that was an incredibly widely read story. So, it was illuminating how much people want to know about the difference between antibodies and T cells and how long immunity lasts and what's the risk of reinfection and all these very esoteric concepts that normally belong in, immunology and virology. People really want to know about. So that has been an education in figuring out what is the new level now of appetite among people for these kinds of really dense scientific concepts, and how do I get that across in a way that actually makes sense to people. And I think some of the time I spent was just trying to put things into context so that every new thing didn't become new on its own. It was, is this really new? Is this really new to viruses? Is this really even new to coronaviruses? So that, they're at a lot of places, because magazines and newspapers have cut science journalism and science journalists away from the, out of their staff. There are a lot of non-science journalists writing about really complicated things, and kudos to them. I think a lot of them have worked very hard to try and report on something they don't have a background in. But it does mean that sometimes they don't necessarily know the difference between what is new to them versus what is actually new in biology. And so I've tried to spend some time putting things into context and saying, no, you're not going to get reinfected with this virus 3 weeks after the first infection, and here's why. That doesn't really happen with viruses, and here's why. So trying to stem panic by actually giving people information about how viruses normally work. And more lately, my focus has been not just reporting about COVID, but trying to widen the lens to other things that really have become a part of the COVID story. So for example, how has COVID affected TB? TB diagnoses have fallen all across the world because people have not gone to the clinics for whatever reason, either because of lockdowns or because they're afraid of stigma or because the doctors, there weren't enough resources. And what the long-term impacts of something like that are. Last year there were more TB deaths than there have been in a decade. And there are similar impacts on HIV, on malaria, on polio. And so I'm trying to widen that lens to see, what else has become embroiled in this COVID story. And again, I'm lucky enough to be able to do that because we have a pretty big desk. I never write about treatments, for example. And I think it's, I can only do these kinds of things because there are other people covering other parts of the pandemic. So I'll stop there.
Thank you very much, Apoorva. I want to now go from New York down to New Orleans and turn the floor to Emily Woodruff. Emily.
Yeah, thank you so much. And it's so nice to see you all. I've been following your work for a long time now. So great to be here. So compared to these other journalists, I write for a very localized audience, which means, I have to be sort of selective about what I write about. So I'm a health reporter for the Times-Picayune in New Orleans. And while I do have a local audience, at times I think it has felt like the whole world's eyes are on us, because we have been sort of, at the beginning of this, the epicenter of the pandemic. And, most recently it felt like, I saw a German newspaper and Louisiana was in it because our rates were so high. But I started here, just to give you a little background, in June 2019. So that was probably like just enough time to sort of like get my feet wet and acquaint myself with all of the public health officials and the local hospitals and everyone that I needed to know before a pandemic happened. I wrote the first story about when I mentioned COVID in January. And by March 9th, we had our first case here, and that was probably like the craziest week of my career still, even having covered a hurricane during COVID most recently. So I am the only health reporter at our paper, and we also cover Baton Rouge and Lafayette. And I'm actually the only print reporter who covers health full-time in the entire state of Louisiana. So, when I started before COVID, there was, I could write about anything, there was a lot of like vaping, which, you don't hear about anymore. I wrote about maternal mortality and health concerns in the environment. But since really March 9th, my entire focus has been coronavirus. So we have had 4 waves here, and like I said, at times, we have been the worst in the country for hospitalizations, for death rates, for cases. You pull up like that heat map that we all see of whatever metric you're looking at. Louisiana is often just bright red. So our entire newsroom at times has turned into COVID reporters. I say I'm the only health reporter. I am not at all the only person covering COVID. So in the beginning, when this all started, I was really, you try to figure out the pace of things, right? Like you're saying like, okay, breaking news was basically my job for that first week, because we were, at the leading edge of this outbreak, not really knowing how long it would last or what would happen. At times, New Orleans was, the most deadly place in the world for coronavirus. So you're just trying to get your mind around it. And every wave since then, my pace has kind of changed a little bit. Like I alter how I approach things a little bit. And usually what that means, regardless of what I'm writing about, is how does this affect Louisiana? How are we different from the rest of the country and the rest of the world? How are we the same? What can the world learn from us? And really at this point, it's really the look back. After every wave, I think we all kind of did this, okay, what just happened? And each wave that lens gets a little wider and the picture gets a little bit bigger. And so now I'm really focused more on what does this mean for our state long term? Like, how is this going to affect people's lives? And I'm trying to really put a focus back on humans in my stories. I think I approach this maybe differently from you, Kai. You said at the beginning, you were molecules and then people. I was probably very focused on the people, and then kind of this world of viruses opened to me, and I found it really fascinating. But now I'm trying to circle back to the people in a way that at times I couldn't during the pandemic, because we couldn't go out and report in the same way. So that's where I am now.
Thank you so much, Emily. Really, really interesting insights from everyone there. And I hope to pull on a few of the threads that came up in those introductory statements. And I want to turn first to Apoorva. And you touched on this in your statement, and your reporting, including some of your great work this week, has sought to highlight the nuance of perspectives between experts. This is not something that's foreign to the legal system, where courts are regularly asked to weigh the expertise of evidence as well as their evidence. But at the same time, the pandemic has tested the lanes of experts. Just as an epidemiologist might not be the best person to answer what's the best medicine for a condition, a clinician may not be the best person to answer what's best for public health. So taking all of that into account, as a journalist, how have you found weighing those different types of expertise, particularly when you're dealing with that sort of nuance?
Yeah, I think that's been a real challenge during this pandemic throughout, especially in the early days when there were really not a lot of coronavirus experts. I mean, there were maybe a half a dozen people who had worked on this in any significant way that you could call up and talk to. So in the very beginning, it was sort of tricky to find people who were fully qualified to talk about this. And, because of what I was talking about earlier, that there are a lot of places in which there haven't been enough science journalists, there was a lot of toxicologists talking about epidemiology and things like that, because there were a lot of posers. There were a lot of people who on Twitter or in general were pretending to be experts. But I think I've been lucky in the sense that I've been a science journalist for 20 plus years. And I've written a lot about viruses, and I could go to people who worked on HIV and knew a lot about this in general, or immunologists who had already talked to for other things in the past, or infectious disease experts who generally know how we should think about transmission. And then as the field of COVID became more sophisticated, it became easier. But you mentioned the story this week, which was about, I think you're talking about the one about the boosters, that in these CDC and FDA advisory meetings, the votes come out saying, yes, we want boosters, but really the nuance is so important, because in the discussions between these experts, there's no agreement. And most of them actually think boosters may not be needed. And so why are we ending up with the yes votes? And really for that, I credit the fact that, you have to get to know scientists. I think that's really the only way. And if you think of science journalists as the conduit between scientists and the public, it becomes so important for science journalists to know which scientists to talk to, how to speak their language, how to understand their jargon, how to read between the lines and see where they're being cautious, because of course scientists are so incredibly cautious about criticizing anybody else. So it's about their comfort level talking to you. And I've spent most of my career either writing or editing for scientists, and I think that's given me a facility for talking to them. I used to work at Nature, where Amy works now, and even the magazine that I was the editor-in-chief of, it was for scientists. So I think it's really hard in the middle of a pandemic to figure out who the real experts are, but that's the only way to get to the truth, because there are a lot of people, even now on Twitter, who are experts in some medical field, who don't actually know enough about epidemiology, but who talk a lot about whether we need vaccines, whether we need boosters. People who don't know anything about supply chains talking about, is it really a real choice between vaccine booster doses for the United States versus vaccines for everybody else? And they really should stop talking, but they don't. So yeah, it is a very important thing to do.
Kai, can I pass to you?
Yeah, I agree, with most of what Apoorva just said. I just wanted to add a little counterpoint, because when I think about like the experts and what it's been like talking to them over the last 2 years, I think one of the things that I find really interesting is that there was this moment early on in January, February, March, but probably all the way through to late summer of 2020, where you could really tell that experts were still weighing the evidence and trying to find their own position. And to me, that was an incredibly beautiful thing in a way. Like, it was like you could really have these debates with these scientists, and they didn't have a set view yet. And it really allowed you to interrogate kind of what goes into making up your mind in a way. And I find it really interesting, because the big thing for me in this pandemic has been, understanding how degraded our information ecosystem is and how dangerous it is, what is happening. And I feel like even with these experts, I've seen this happen now over, a lot of them have gotten famous on Twitter. They've and you get locked into a position, because you kind of, at some point you give interviews, you say certain things, and then you have you've bought into a certain position, and there's some motivated reasoning to make yourself feel like you've had the right position. And then, of course, you also have, a Twitter following that follows you for a certain reason. And so you can tell that there's some scientists who've kind of been on the spectrum more of, okay, we should do everything we can to, keep numbers as low as possible. Other people who've been a bit more on the fence about that and so on. And now it feels like it's becoming more difficult for me because I feel like choosing who I talk to already, determines what the story is going to be, because I know for a lot of these people what they're going to make, and they don't take a new piece of evidence necessarily and really look at it, as a completely new piece of evidence. They fit it into the structure that they've built over the last 2 years. You can argue that that's, how it works, and that's a fair thing to do. But I have to admit that those first few months, I really, there was something in the way that you could talk to very different scientists at that point and have very, open, honest discussions that to me was really a very special moment in a way. I mean, it sounds terrible because it's a terrible pandemic and we all wanted it to, go away, but that was very different from what the situation has become. And just as a little counterpoint to what Apoorva was saying, because I think she's absolutely right, but there is this other thread going on.
So if I can draw that into one of the questions that have come up in the Q&A, is invariably when we have a novel pathogen, and sometimes not even when it's a novel pathogen, we have a new circumstance in which the pathogens emerged. There is a reality that we have unknowns. And what is the role of reporters, or how have you seen the role of reporters, your work in helping communicate that uncertainty to the public, or that unknown? And one that comes to mind early on was, obviously on January 14th, when the WHO tweeted about there's currently no evidence of human-to-human transmission, and that of course got interpreted by people to say there is no human-to-human transmission, and so. Which was not what was necessarily being said. So how do you deal with that communication challenge of uncertainty and unknowns with the public that it will invariably occur with the next pandemic? I open it to whoever wants to jump in. Amy, yes.
Well, I guess just one quick thing I would say is it's a trick to be able to say it's uncertain and say why it's uncertain, but be careful to not have that uncertainty it can very quickly lead people to doubt the science or be suspicious that somebody is saying something wrong or has some deeper, reasoning for their. So I think in short, in something like that case, it's very important just to say, this is where we're unclear and this is why, before it kind of quickly fuels into a million sort of shadowy arguments that aren't based in science.
If I can add to that, I think Amy's absolutely right that you have to be very honest about what we know, what we don't know, where are we, what do we need to be able to get more clarity on this. And the other thing that I think has been happening during this pandemic is people have been pointing fingers at the general public and saying, people don't have a good understanding of science, people don't have a good understanding of scientific uncertainty. And that is all true, but I think that the public health community has also not been the best during this pandemic. I think in trying to make things clear for people, they have skipped a lot of steps, they have skipped a lot of nuance, they have tried to oversimplify to the point where they've pretended certainty where there is none, and that's actually brewed a lot of mistrust from the average person, because most Americans don't go through a system where they learn all about the scientific process. So you can't suddenly end up in the middle of a pandemic and say, okay, now I understand everything about scientific uncertainty. This is just how it works. Why are you so stupid? Why don't you understand this? And it's because we haven't done that throughout. There's been no communication about this all along, and I think public health experts could have done a better job of telling people this is all we know and it's going to change in the next 2 weeks, instead of pretending a level of confidence that they didn't actually possess.
So that ties quite nicely into a question I'd wanted to ask you, Kai, about the different approaches to scientific evidence by decision makers and how that's been communicated to the public. So in particular, thinking about the AstraZeneca reporting and the European Union. So while the science itself has been globalized, interpretations about the conclusions and the weighing of risk and benefits and even the regulatory processes themselves changes quite a bit between regions. For you, do you find that there's something in particular you keep in mind, given that you are writing for a global audience, with those regional differences?
Yeah, that's a really interesting question. I think so. I reported a lot on the AstraZeneca kind of side effects when they became, when the first signs were there that there were very rare side effects that were really serious, and that was a really difficult situation, I think, because like you say, I mean, different places weigh the evidence differently, but also from the beginning, it was very clear that the decisions that would have to be made on the risk benefit of these vaccines would have to do with what vaccines are available, if any, and what alternatives would be available. And of course, it directly ties into the equity question, because then it becomes a question of, okay, I mean, for instance, Germany a few months ago, I got a press release from the German government, proudly announcing that we were donating a few million doses. And of course, it was AstraZeneca doses, which at that point, nobody in Germany, was interested in having anymore. So it becomes a very, again, it touches on all of these different aspects. I think what was interesting was how much more heated all of that became in Europe because this vaccine was being used here versus in the US where it wasn't being used. Because it was seen in the UK as, a point of national pride. And, there was this whole debate whether they would, print the Union Jack on the vials or something. I mean, so there was this, it became very political very quickly. And you had this weird moment where on the one hand, the European Union was fighting with AstraZeneca over how much vaccine they were actually sending to Europe. And at the same time, this question was coming up. And you could really see that for a lot of, I think Apoorva mentioned that a lot of other journalists were kind of starting to report, of course, on COVID, and a lot of them did a really good job. But I think especially with the vaccines, it was interesting to me that a lot of the science journalists, I think, were being overly cautious reporting on the side effects because of what we've seen in the past, and almost, out of a public health thought of, we don't want to shake the public's confidence in these vaccines, which I always felt was wrong, because this was one vaccine and it wasn't about, all vaccines. It was reporting what we know on one particular vaccine at that stage. And then on the other hand, you had, the non-science reporters who were really milking this sometimes for political points. I remember there were stories about, Angela Merkel refusing the AstraZeneca vaccine when the way that the law was, the way that the recommendations were in Germany, she wasn't supposed to get that vaccine. So it just became a mess very quickly. And I think it had a lot of impact. And then of course, whatever we write here is being, I mean, that's also something I learned in the Ebola epidemic, is that whatever we write in Europe, it is being received, in other countries around the world. And there's people in Southern Africa, reading these stories, and they get picked up. And maybe AstraZeneca is the only vaccine that's available there. So I think it's a really, really tricky situation, because I empathize a lot with Emily. I think I think that the local reporters are doing probably the most important job in this, because they are the ones who really have to translate this, to the individuals that are making decisions about their behavior that are directly impacting the pandemic. But it is a global pandemic, and stuff is being received globally. I don't think it's something that you can really solve, but that's certainly, with AstraZeneca, just the dimension, the complexity of this became very apparent.
Yeah, thank you. And that actually ties us quite nicely to a question I wanted to pose to you, Emily, moving from the regional to the local. This pandemic has demonstrated inequality across race, gender, socioeconomic lines. And at the same time, the impact of politics on choices has been particularly stark, even overcoming other barriers to healthcare. You're at the complex intersection of compound hazards of infectious disease and climate change, and the politicization of both. Do you have a process or an approach that you take when reporting on those intersecting challenges, given the parallels and differences and in the way they intersect together?
Oh, that's a good question. I would say, my approach, this has become like very political in our state. And you can see, just looking at the data, you can see across, parish lines, like parishes are what we call counties here. And more conservative places are less vaccinated. They, experienced more deaths in this last wave. So I think my approach is always just to talk to as many people as I possibly can. Like when I think I'm done, just keep talking to people, to go to these places and try to understand their point of view. On Friday, I was out in a more rural, conservative parish, kind of, I guess about an hour and a half northeast of New Orleans, just trying to understand what they've been through, and what they're reading. They're about 36% vaccinated, which is pretty low. Louisiana's rate is about 47%, which is also pretty low. But I think always just trying to understand, and I haven't come back to environmental piece of it in a while. That was more, I think, pre-pandemic, and we do actually have a pretty big environmental team here, so they handle a lot of that. But I think my approach is just to always like get in there and try to understand it. I don't know if that answered your question.
Yeah, absolutely. And if I may, just sort of draw something out from that, and then also turn it to others. And this pulls from a question from the chat. But do you find that there is a role as a reporter in being an advocate, or do you try to not toe the line of advocacy? And how, as a journalist, do you, particularly when we are all experiencing the pandemic, and if you are seeing political choices, how do you balance that role as an advocate or not as an advocate?
I think, this is something that I thought about when the pandemic was first starting, and maybe I kind of went back and forth on more. And now I feel a little bit more like, advocacy is if just reporting facts and science and good public health information. I don't really see that as advocacy. I just see that as what a reporter does. So, I think I'm a public health reporter. I want what's best for people and for my state. So, but I don't know that makes me an advocate, but I probably feel a little bit more like an advocate now than I did when I first started pandemic reporting. But I'd be curious to hear other thoughts on that.
Yeah, does anyone, Amy?
It's definitely something I've thought about. So, I'm not an advocate in the sense that I'll push for, strongly, my pieces are not opinion pieces, but I feel like we're all biased, partly in just what we decide we want to cover. The fact that I'll want to cover, number one, starting from a place of I don't want people to die. I don't like people dying. And then also what you decide to cover. So, I think the fact that vaccines haven't gotten around the world and are very rare in a lot of places, that's a big problem. And I feel like that's an opinion I can hold, and that's kosher to hold such an opinion. And so instead of advocating, which I'm not going to do, what I could do is write a story about, number one, have voices in there about how people feel about not having vaccines. So for example, I wrote a story about how, a lot of scientists want more open sharing of genomes, of coronavirus genomes, but I'll talk to researchers in, say, the global South, and I talked to one researcher in Nigeria who pointed out, you're screaming at us to share openly our sequences. How about the vaccines? There's some hypocrisy. So I should say it's not me advocating, but the sources I'm talking to are their own advocates, and they can be in my story, and they're relevant to the story. I did another piece that was about kind of where, how would it be possible to expand vaccine access? And I talk with people who point out, specific pharmaceutical companies in India and Brazil that, can make things like adenovirus vector vaccines so that it would be possible for them to make it. So again, that's not advocacy, but if one was an advocate or wanted to advocate, that might, give people ideas about how to move forward to ramp up supplies. So I guess that's, I think it's not advocacy, but it's putting ideas out there that could be used in various ways.
Kai?
Yeah, I think the word advocate is really difficult. I think my problem with advocacy is, I read a book a few years ago called How to Campaign, which I think is like a kind of a Bible for, you know, for people in NGOs. And it was really interesting to me because I wanted to understand how these campaigns work. And one of the points it makes is that, you know, in order to campaign well, what you have to do is you have to reduce nuance, you have to make it into a black and white decision. Like there's a lot of stuff that's diametrically opposed to what journalism should do, what good journalism is, which is to give nuance, to, you know, have this gray area and explain it to people. So of course I have certain convictions that flow into my reporting, like Amy said, and I think, you know, we can be advocates for truth without actually knowing what exactly the truth is. We can be advocates for, you know, trying to get as close as possible to the truth, and we do know sometimes when something is not true, and we can be advocates for that nuance. I think really one of the things that I realized too late in the pandemic was that what Apoorva said is exactly true. There's suddenly this huge appetite for stories. And I think a lot of the kind of mechanisms that have become normal in journalism to get people interested, which often has to do with reducing nuance, that's simply not necessary. People are so interested in, you know, in getting whatever good information is out there. You don't need to, you know, make it somehow more interesting by shedding the nuance. So I've really enjoyed the ability, I have to say, to, you know, put a lot of nuance into these stories and a lot of complexity as well, because people in this particular instance are really, really willing to try and engage with the complexity because they really want to understand it. And so I think that's where it kind of, you know, where it becomes complicated with the advocacy, because, you know, even when it comes to distributing vaccines across the world, there's a lot of complexity to that, to what is a fair distribution even. That's not an easy question to answer. Giving 20% to everyone, you can argue, and ethicists have argued, is not the equitable way to distribute it. So I think, you know, we can raise the right questions, I think, like Amy said, but yeah, I think like everyone who's kind of gone through journalism training, you know, I do have a problem with advocacy, even though I realize that in the degraded information ecosystem that I mentioned earlier, our roles are changing a little bit. And certainly on Twitter, I think I am, you know, I in a kind of gray area there, and I have a slightly different position. I think the New York Times would probably fire me for being in violation of their social media policies. But yeah, but I'm a freelancer at Science, so I can do that, I guess.
I mean, I can speak directly to that. I don't think they would fire you, but I have you know, had some conversations, shall we say, about what I should and should not say on social media. The Times does have very strict rules, but you know, I think anybody who's reported on public health, anybody who's reported on global health, can see that it's not just an opinion, that there is a sort of ethical dimension to all of this that is undeniable. And I don't think you need to be an advocate to present it. I mean, you know, for example, everything we're seeing play out now has already played out with AIDS drugs. And I reported on that, you know, almost 20 years ago. And it's exactly the same arguments now. So one way in which, you know, the story that you brought up earlier about boosters. So one way to talk about how maybe we don't actually need these booster doses is to highlight the fact that in the vast majority of the public health community, among experts who actually know how this works, they don't think boosters are necessary. So there are ways of shining the light onto the majority opinion and away from the political agendas that makes the point without I myself having to be an advocate. You know, like Amy said, a lot of it is in what stories you do, what sources you talk to. And it's very helpful to know what is actually going on so that you can help the readers also understand what's going on. But I don't think that any of us need to be advocates to do that.
Yeah, I think that connects in when we think about where the pandemic is going. You know, you have major outlets around the world still, you know, framing the pandemic as over and using terms like post-pandemic, you know, whereas here in the United States, we're still at 1,600 deaths, you know, a day. There's also the legacy of what has happened and the memorial and the remembering of what we've actually gone through. And so I wonder, is how do you create that sort of focus when there may be greater pushes, like the public not wanting to continue to get into depth, or the push from editors to be moving on to other stories, when the reality is we're still still in the middle of this pandemic with a long way to go. Yeah, Kai.
Yeah, it's just briefly, because this is something so a friend of mine who's a filmmaker here, he went into ICU in January and February to film, you know, everything that happens there basically during the wave here. And he made a very good documentary series out of it. And so when it came out earlier this year, I watched it, and that was literally the first time that I cried in this pandemic, because I realized that I had spent 1.5 years just like keeping myself busy, being alone in my apartment in Berlin and just writing and just trying to, you know, a lot of people didn't have the luxury of having something to do, but I felt, even though it often felt kind of like, you know, you were shouting, you know, into the wind, it was something that you could do. And when I saw that TV series, it really floored me. And I wrote a piece about it in German, and because it really made me realize that there is so much that we've all lost in this pandemic. And, you know, I'm not just talking about people who've lost loved ones. I mean, we've all, you know, lost whatever, a nice summer. I mean, whatever it is, you know, people who just, you know, had the first year at university. I mean, I've lost some of my faith in humanity, I think, when I look around sometimes and see how callous people are, and how easily people were dismissing, you know, older people dying. And I mean, there's a lot of grieving that has to be done. And I'm not really at that stage. I think that documentary series really showed me that there is going to come something. And you know, when it comes to viruses, I know who to call to ask them for an expert opinion. When it comes to this, to grieving, to the psychology of it, to the how do you deal with this collective trauma, you know, and there's individual traumas, there's the trauma of, you know, certain disenfranchised and disadvantaged populations who've suffered more than others. How do you start to deal with that? I'm not the person for that. I hope that other people can take over there, because I have very little to contribute on that. I'm curious to read it myself, because I think we do have to go through it, and there will be a phase, I think, of people being just, okay, you know, let's forget about this. Finally, we can go out again and party and all of that. But I think that there also has to be some space for, you know, for confronting this. And it might not be immediately after the pandemic. It might take a few years before people are really ready to face it in a meaningful way. We've seen that with other large historic events. So, yeah.
I was going to say that I think I have not had to experience my editors wanting me to move on, because I think they recognize how important it is. But definitely readers have stopped at times, before Delta especially, wanting to hear anything about what was going on. And even among other journalists who maybe haven't always written about science or even aren't writing about it now, this perception that somehow the reporters who are writing about COVID are being too negative and being too depressing. It's like, well, it is depressing. What would you like me to do about that? Would you like me to lie about what's going on? And this idea that somehow we should focus on the positive, and we should tell people that the pandemic is going to end any minute now, so that they feel energized. But the pandemic is not going to end any minute now. And so I don't think we should say that ever. And we've been wrong. We've thought many, many times, especially in America, that it's all over, that this is the last wave. We're never going to see hospitals full again. And we've been wrong every time. So I would hope that we could get that lesson through our brains and understand that as much as we don't want to hear these harsh truths, they are true and we should pay attention to them. And I think Delta made that point for us in a way that we couldn't even really do with our articles.
I'm cognizant of not ending on a sad note. We've got enough of that, and I want to think about a little bit the future. And Amy, I want to just turn to you for the sort of a last comment on. You spent some time during the Ebola outbreak in DRC embedded with the WHO, and you spent some time sort of at that real watching how pandemic response happens. And I imagine that puts you in a very prepared position for COVID-19, but would be interested to hear your views on how journalists are actually a part of our pandemic preparedness and what we can be doing now and in the coming years to prepare journalism for the next pandemic.
That's an interesting question. So I think I should say, you know, reporting closely, you know, knowing the WHO from that experience, and then also, you know, from being in other countries and seeing how the WHO operates, and kind of, I guess one issue that was good was to really, one is to see what's happening in communities or in the places where outbreaks are happening worst, and also to spend time with WHO or other public health officials to see what they're dealing with and what the context is, because I think, you know, just to be more specific about it, I recall very much from when I was in DRC, I went to where the outbreak was in Beni and in Butembo in northeastern DRC. That's an area that has lots of conflict all the time and is very unstable. And something that was just so memorable to me was to go from having reported on it from afar, or even in Kinshasa, in the capital, which was, you know, might as well be another country away. There's a whole like kind of global health community and research community that was really mad at the WHO because they had not at that point declared a public health emergency of international concern. And there was all sorts of writing about this and articles talking about this. And then you get to the place of the outbreak and you'll see extreme poverty and people who are just broken because their closest loved ones have been killed by armed groups in the area, and nobody cares at all. Meaning, to the extent where you'll have like, you know, troops who have seen the deaths. So they're handling this plus Ebola. And then the WHO is hearing from a lot of officials there when I sat in on a lot of these meetings, hearing like this fear that if they were to declare this public health emergency, borders might shut. And they're on the border of Uganda. And that meant whenever there's violence, while I was there was a massive attack and, you know, hundreds of thousands of people flee. So people couldn't flee across the border, and also all the trade, people had families across the border, and there's just regular trade for fuel and shoes and everything else. So the idea that that border, a very real effect, the border would shut and people wouldn't have access to that was real. And meanwhile, if you looked at Twitter or the media landscape, the international media landscape, it was all about how in the world is the WHO not declaring a fake? This is terrible. And it just seems so completely divorced from the situation. And there was no real large presence of other humanitarian assistance there at the time, you know, besides DRC's own. So I guess that's all to say, it's really important that the media really tries to talk with people from the places that are affected, and ideally researchers or doctors in the places that are affected who are from those places, and getting kind of the whole picture of what's going on, because things can seem really quite different from afar.
Thank you very much. Thank you to all our panelists. I'd like to hand back to Chloe to close out our session.
Well, thank you everyone for attending, and thank you to our panelists. It's really an honor to have you, and thank you so much for the work that you've done over the past year and a half of the pandemic. It's tireless and thankless, but we really appreciate you shedding light on some of these important issues today. So that's all for our event, and we will post the video once it's captioned. Thanks again.